I was having trouble with my teeth.
Bridges, root canals, you name it, I had it done.
It was just getting worse and worse, and it was time to do something about it.
I went to Dr. Trevisani to see if he could fix all the damage from the past years.
When I first saw my teeth, it was joyous, it was relieving.
And I jumped up from my seat and I hugged him. I couldn't believe it. I really couldn't. I was so excited.
When you're all done and you get exactly what you were promised to get, I don't know that it gets any better than that.
It's almost like a miracle to me. And I look good. And my teeth are beautiful.
Thanks to Dr. Trevisani, I'm completed.
Hi, I'm Fawn Creamer. These are just some of the life-changing results from the groundbreaking dental procedure, Lifetime Teeth Today, from board-certified oral and maxillofacial surgeon, Dr. Ronald Trevisani. In just one day, years of dental problems are no more, allowing you to eat all those foods that you've missed and giving you the most beautiful smile you've had in years. You'll learn more about this procedure, how it's done, how it benefits you, and who are the talented surgical professionals behind Lifetime Teeth Today. You'll also get to meet Renee Bryant as she goes through the Lifetime Teeth Today transformation. Lifetime Teeth Today, all in one office, all in one day, a permanent set of teeth for you to eat, drink, and dance for a lifetime. Dr. Ronald Trevisani is a 20-year board-certified oral and maxillofacial surgeon and the man behind this life-changing procedure. Thanks for being here. So tell us, doctor, what is Lifetime Teeth Today?
Well, Lifetime Teeth Today is a process where we replace missing teeth and dentures with beautiful permanent dental implants that look, feel, and function like your natural teeth.
Very nice. Who's your average patient?
Well, we have patients from all walks of life. Basically, anyone who suffers from adult tooth loss or severe gum disease can benefit from our procedure.
Now, being a board-certified maxillofacial surgeon, how is this different from a traditional dentist or an oral surgeon?
Well, once someone graduates from college, it's a 4-year undergraduate program, we go to spend 4 years in dental school. After that, the best of the best apply to and get into an oral and maxillofacial surgery program. This is usually a hospital-based residency program where the additional training is anywhere between 4 to 7 years. During this training, we're putting people's faces back together. We're doing maxillofacial trauma, we're doing cysts and tumors of the upper and lower jaw, we're completing facial cosmetic surgery procedures. In addition, we're growing bone and we're placing dental implants, and that's what we're here to talk about today.
Absolutely. So Dr. Trevisani, let's meet one of your patients, Renee Bryant. Here's Renee the day before her Lifetime Teeth Today procedure.
I have a full upper denture. They look good in public, but I can't eat with them. I can't function with them properly. They slip when I talk. And a lot of people that I talk to that had dentures, they's like, oh, you're gonna get used to them, everything's gonna be all right, you know, and I was like this black sheep, you know. I was like, I can't get used to these things. What's wrong with me? I used to tell people I felt like a horse with a bit in his mouth. That's exactly the way I feel with these dentures. I feel like a horse with a bit in his mouth because that's the way it restricts me, you know, from doing anything. I happened to run across Dr. Trevisani on the internet, and you know, he was an implant specialist, so I was definitely interested in hearing what he had to say since he does it all the time. You know, and I researched it in the internet. Everything was good about him. All of his ratings were 5 stars, you know, and everybody had good things to say about him. He definitely has a lot of degrees. So many degrees he looks like a thermostat, but he is a good guy. He certainly knows what he's talking about. Dr. Trevisani is the one that told me about having the shallow palate, and the reason why my dentures would not stay up in the top of my mouth. Earlier today, he called me personally. He called me and wanted to make sure I was all right, wanted to make sure that he answered any questions I might have about the surgery coming up. That said a lot, that he called me, you know, personally, not just some assistant, not, you know, the doctor himself called me and wanted to know if I had any questions about the procedure. My husband, he's ecstatic about it because he knows that it's been very depressing for me wearing these dentures. It's been very depressing. I've never been through a state of depression as I went through having these dentures. Never. There will be a huge change in my life after I get the implants. I mean, I'll be able to function in public again. When I go to a restaurant with my husband, we always get the darkest spot in the room. I mean, you know, or in a corner somewhere, so I can, you know, sit there with a napkin and pull my teeth out, put my food in and eat, and then put my teeth back in, you know, and then, you know, I don't want anybody to see me without my teeth, except I just, it's getting harder and harder and harder to deal with them. After I have my surgery, Dr. Trevisani is going to put these implants in, and it's going to be a more permanent thing. It's a fixed thing. The teeth ain't going to fall out. You know, I'm going to be able to eat again. It's just going to be, really, it's a light at the end of the tunnel.
Now, Dr. Renee is just one of the many patients that turn to your offices for dental answers. Here are just a few of the many questions you receive over email and social media. Frank asks, I've been told I have severe bone loss and there is no hope for me. Can Lifetime Teeth Today help me?
Of course, many times we have patients who are told that they do not have sufficient bone for dental implants. Well, in our office, we have special techniques available that allow us to place implants using their existing bone. However, if additional bone is required, the procedure that we utilize is both minimal and fast. We actually grow new bone. What used to take 6 to 9 months, we can now accomplish in 1 day.
Doctor, what about people with other dental problems, such as periodontal disease? What is the danger of not acting or not undergoing the Lifetime Teeth Today procedure?
Well, even if you have no pain, if you notice that your gums are receding, that teeth are becoming loose, that your breath doesn't smell as fresh, or if you notice that your jaw is either shrinking or melting away, you may have an active infection with progressive bone loss. These infections simply do not go away. They continue to do their damage on both bone and gum. And as time progresses, it may be more expensive the longer you wait.
Now this question is from Janet. I've had dentures for as long as I can remember. Are you saying I never have to wear dentures again?
Well, it's a fantastic question. The answer to that is absolutely. Our patients have been suffering with traditional dentures. Those are the patients that have the greatest potential for this procedure to be a life-changing experience. Just imagine eating the foods that you love, eating healthy, not worrying about those messy pastes or slipping dentures, not having to remove the teeth at night, smiling with confidence like you do, Fawn, having the most beautiful teeth like you have, Ms. Fawn, and most importantly, feeling better about yourself and enjoying life. It truly is a new lease on life.
Sounds amazing. All right, here's a question from Bob right here in Orlando who simply asks, no pain, how is this possible?
Well, I'm so glad you asked that question. It gives me a great opportunity to tell you about one of the most unique features of Lifetime Teeth Today, our micro laser oral surgery. The pulse of the laser that we utilize in our office is less than 700 microseconds. This means that it is faster than a simple nerve can respond to. With this laser, it means that there is less pain, less swelling, less bleeding, and a more quick recovery. We've had many patients tell us that after surgery, they took only 1 or 2 pain pills and that's it, and that's very impressive. After the procedure, they're driven home, they take a nap, they wake up with minimal discomfort.
So not only is there no pain, but it's all in 1 day. How is that possible?
We are actually the first and only implant center of its kind here in Orlando. We now have the ability to begin the procedure in the morning, do our procedure, have the patient home before lunch with brand new, beautiful, permanent teeth. I'm very impressed with our top-notch oral surgery team because we also have a full-time prosthodontist and a complete in-house laboratory facility with not 1, not 2, but actually 3 dental laboratory technicians, and they're all in the same office.
So how important is it to have that in-house lab?
Well, it makes all the difference in the world. And not only can we make any necessary changes right on the spot, but we can exercise extremely tight quality, assuring that we provide only the absolute best, most beautiful teeth that those patients have had in their lifetime.
Here's a question from Linda in Celebration. I've heard of zirconia implants. Are those better? What's the difference?
Well, she is referring to Pretal zirconia implants, which we utilize in our office. Zirconia, just like diamonds, is one of the hardest materials known. There is no chipping of the teeth, there is no staining of the teeth. In fact, it is actually stronger than your natural teeth. It is completely biocompatible, meaning it causes no reactions in your body, and they look so real it is virtually impossible to tell the difference between Pertau zirconia, which we have in our office, and patients' natural teeth. And only the most advanced implant centers produce Pertau zirconia. And we are the only oral surgery facility in Orlando that produces these zirconia teeth in our own lab with our own trained laboratory technicians. We're very proud of that.
Don't just take our word for it. When we get back, we're going to visit the Lifetime Teeth Today Dental Implant Center as Renee begins her life-changing procedure.
My impressions of Dr. Trevisani and Dr. Z is that they're, number one, very skillful, very talented men. Most people who are walking into a doctor's office, they're walking in because they've got a problem. And he will not allow you to sink into the problem. His nature is one of, we can handle this, we can do this. Hope springs eternal in Dr. Trevisani. When I used to play football and took a helmet in the face and on and on and on, I gotten to the point where I had lost more teeth than I had in my head. For a whole year, I had my mouth wired shut. And so I had decay and everything else down up under the gums. It was just getting worse and worse. And it was time to do something about it. I'm a pastor, and I was directed there. When you turn something as major over as the reconstruction or the development of your mouth, you've got to have confidence in that individual, because you could wake up looking like Godzilla or somebody if you were the wrong person. The procedure itself was smooth. He did his thing and I did my thing. I didn't know I was there. I was in limbo. I don't remember teeth coming out. I don't remember any pain associated with anything. I didn't have any pain. The results are evident. I don't have to say anything about the results. It's nice to be able to sit down and chew and have something to chew with. We had corn on the cob last night with a piece of filet mignon, so it made my toes curl up. It was so joyful. When I first saw my teeth, it was joyous, it was relieving. It wasn't, there was no more of this piecemeal kind of stuff. There was no more of, what are we going to do? It permitted an accomplishment that needed to be done. So now I can go on to the next phase of my life without taking attention away from the Word of God or whatever message or anything that I'm working on. Thanks to Dr. Trevisani, I'm completed.
Beautiful, permanent teeth, all in one office, all in one day. We believe everyone deserves a lifetime smile. Call today or visit LifetimeTeethToday.com.
Welcome back. Earlier we met Renee Bryant, who turned to oral and maxillofacial surgeon Dr. Ronald Trevisani and Lifetime Teeth Today to reverse years of dental problems.
Hello there, how are you? Are you guys excited?
Yeah, I'm nervous.
Of course you are, of course you are. Well, today's the big day. You ready to get the most beautiful teeth you had in a couple of decades? You have any questions? You ready? Come on, let's go get those beautiful teeth.
So Dr. Trevisani, today is a big day for so many of your patients. Take us through what is about to happen.
Sure, let's do it.
All right. Now, as we see Renee is being led back to the exam room at close to 9 a.m., what is the first thing you would usually do?
Well, what we typically do is give the patient some light anesthesia before we get started. Then we reevaluate the three-dimensional CT scans that we've taken in advance to determine where we place the individual implants for each individual patient.
Okay, and who is the team helping you?
Well, that's our wonderful Dr. Zaman. He's our outstanding prosthodontist who I consider one of the best in the industry. Dr. Zaman assists me in placing the implants in the most perfect position possible. His specialty is making the teeth look 100% natural and the end result being a perfect bite. All of our patients rave about the quality of Dr. Zaman's work. We feel very, very lucky to have him.
What are the implants made out of?
The implants that we utilize in our office are made of titanium. Titanium actually fuses with the bone itself. To Renee, these implants are going to feel exactly like her natural teeth, something she hasn't had in years, and they will be very, very strong. After I line everything up, Dr. Zaman and his team finish the procedure.
And how long does this usually take?
Well, with Renee, as you see, in a matter of hours, we're able to give her a new set of teeth and the smile that she has always wanted for a lifetime. You guys, you have one happy gal. Congratulations. You got a smile of a lifetime.
They feel great.
What do you think?
I love them.
I'll tell you what, it couldn't have gone better. It couldn't have gone smoother.
I absolutely love them. I can't say enough about them. I really can't.
If you love them now, wait till 1 or 2 months from now.
They feel so real. I mean, they feel like part of my mouth, really.
Yeah, well, that's
Sure.
right. That's right. Listen, bless you. Listen, I want you to, we're going to check up on you in a couple of hours. Go home, tuck her in. We have all the instructions. We're going to check up on you this afternoon, and we'll check up on you again in the morning, and we'll see you next week for a follow-up, okay?
You just saw Renee hours after surgery, and as you could see, she could not stop smiling. Her days of embarrassment, eating in the corner of the restaurant, suffering with painful dentures are over, and it was all done in one office in one day. When we return, we'll check back in with Renee weeks later to see just how much Lifetime Teeth Today has changed her life.
I was having trouble with my teeth, and I had gone to a dentist locally in DeBarry, and she had put all caps on my teeth, and it cost me a fortune, but they kept dropping out, and my boyfriend kept having glue, and I kept gluing the teeth caps back. My boyfriend Don said to me, "Go to a dentist and get your teeth fixed, will you please?" And somebody said, "Go see Dr. Trevisani." I said, "Ugh, what is he going to do?" And I went to see him, and he was a sweetheart, an absolute sweetheart. He looked at me and he said, "Honey, you need implants." And I said, "No, I don't want to have my teeth pulled." And he said, "No, you have to have implants." And I said, "No," and we kind of talked about it a little bit, you know. And well, anyway, I had it done, and here I am. When I got my teeth finally in, I went and had steak and I celebrated. I could taste it, and it was just delicious. It's like having your own teeth. I enjoy life much more, I really do. I don't have to worry about toothaches, fillings, or anything. It's just wonderful. I had it done, and it was the best thing in my life. The best thing I ever did, really, really. I mean, look, I can smile, I can eat, I can talk without anything happening to my teeth, without my teeth dropping. I'm sorry that I didn't go see him right away. When I first wanted to change my smile, I should have gone to him immediately. And I'm so sorry that I didn't go. I really am. If I had a son, he would be Dr. Trevisani. Yep, I would, yeah. The only thing I can think of is Betty White. Just keep away from him, because I saw him first, okay? Back off, girl. But you can have your turn if you get a couple of little boyfriends for me. A couple of your discarded boyfriends, okay? All right, that's it.
The first and only of its kind in Orlando. Protal Zirconia Implant Bridges. Stronger than your natural teeth. All in one office, all in one day. Visit LifetimeTeethToday.com to find out more.
Weeks after undergoing her Lifetime Teeth Today procedure, we visited Renee. Our cameras captured the remarkable difference this procedure has made in her life.
Oh, it's been about a month now. It's been an experience. It's been a good one. It feels really good. It feels like the old me is back. It really does. I don't have to hide. I don't have to be ashamed of it. I don't have to, sit in a corner somewhere and cover my face as often as I did. It feels really good to be me again, really. Dr. Trevisani definitely knows what he's talking about. He told me what was going to happen, and that's what happened. It was more than I expected because it turned out so well. Even the night that I come home, Dr. Trevisani himself called me on the phone and wanted to make sure that I was all right, you know, and I've never had that happen with any other dentist ever, for him to call just a doctor personally. I mean, most doctors don't got time for that, and I can understand why they probably wouldn't, but he did. He took the time to call me and ask how I was doing, and of course I was doing fine. I felt like that I'd finally ended a journey, a very bad journey, and I felt like that, you know, he would help me, guide me through it, and that was a good feeling. I mean, I left there knowing that there was something to look forward to. Everything has changed since this. We go out to eat as often as we'd like. I don't have any problems dealing with the public now, or speaking, or anything like that. You can feel that you can bite. You can feel that you can chew. You can feel that everything feels okay. I mean, you feel the strength in them. You feel it like you do the root of your tooth. I'm gonna be able to eat again. I'm gonna be able to smile again. I'm gonna be able to talk again. And, you know, and do it with confidence and do it without any pain. And it feels good. It feels natural. It feels more like your real teeth than what the dentures do, for sure. It's not even in the same ballpark. I did cheat a little bit and eat a salad, so it was very good, and I enjoyed it tremendously.
Wow, what a remarkable turnaround for Renee. Doctor, are these the typical results you see from patients?
Yes, Renee is just one of many patients who have transformed their lives through this procedure.
Is there any downtime from this procedure?
The downtime is actually minimal. Most patients return to their normal routine within a day or two after surgery.
So how quickly can your patients get back to eating their favorite foods?
Of course, each case is individualized, but we generally recommend a soft diet for about a month or two to allow the healing process to complete. After that, patients can begin to enjoy the foods they've been missing for years.
So how does it feel to hear such nice things from your patients?
It feels wonderful. We love what we do, and we like to think we're pretty darn good at it. Nothing makes us happier than hearing about the positive impact that this procedure has had on so many of our wonderful, wonderful patients.
Dr. Trevisani, the happiness your patients show is truly amazing. Can we pause for a second and see another quick clip from Renee? She wants everyone to know exactly how happy you have made her with Lifetime Teeth Today.
My life has changed and gotten so much better because of Dr. Trevisani that I feel like I just want to give him a big hug just so I can thank him.
Well, Dr. Trevisani, we have a surprise for you.
Hey, what a pleasant surprise. How are you? How are you, honey?
Really happy to see
What do you think?
I love them. I couldn't be happier. I really could not. I'm so proud of them. I just smile all the time now. It's really something to be proud of. It really
Wonderful.
is.
We couldn't be happier with the end result. Okay, grab a seat.
Thank you, sir.
So, all in all, what do you think? Was it much simpler than you expected?
It's much better than I expected. It really is. There's really nothing like your real teeth, but this is as close as you're ever going to get. I mean, it is just unbelievable how real they are and how much bite that I have. I mean, you would really have to get down and examine them to be able to tell the difference in real and what I have. It's really hard to do. So even with me, it's hard to tell what's real and what ain't. I think these look so much more better than my real teeth ever did, ever.
So Renee, what are some of the foods that you've missed that you're now able to enjoy?
I am a big salad and steak eater. I am a big meat eater for sure, and I enjoy steak, and I haven't been able to eat steak since, you know, I had my dentures, but now since I have my implants, I can totally enjoy steak, and anything that you throw at me, I'm more than willing to eat it.
We feel very, very blessed that we were able to help you. And it only gets better from here.
It does.
What do you think?
It does. I'm really happy with them. It really does. But I'm the lucky one, really.
So Renee, for everyone out there watching that's on the fence, what would you say to them?
I would say that don't be afraid. It's not painful. I thought it would be painful. I was so scared before. I thought it would be painful, but it's not. It was the least painful thing that I've experienced as far as dental work. And it was a quick turnaround. I mean, I didn't have any problems with it after we got done with the surgery. I knew right away when these were fixed in my mouth the change that it was going to make. I felt it right then. I knew that it was definitely going to be a difference, and it's been all the difference in the world, really. It has. It makes me more outgoing, makes me want to see people more, it makes me want to smile more, you know?
Now, the ability for us to do this procedure in one office and in one day. What are your thoughts on that?
Absolutely amazing.
It is pretty amazing.
Everything that I'd studied and I'd done a lot of research, it was going to be a two-step implant, and it was going to take at least 6 months to do anything. I was still going to have to wear my dentures for 6 months, but with this, I walked out with a fixed prosthetic, and I couldn't be happier. I mean, that just changed my world. It really did, because I just could not function with dentures. I could not, but I am totally functioning with these 100%. Dr. Trevisani is an amazing man. He definitely knows his job. He made it really easy for me, and he definitely knows what he's doing. I did a lot of research, a lot of dentists that I went to, oral surgeons that I went to, and implant people that I checked with, and he spoke my language. I could understand him. I understood what he was doing. I definitely could see where he was going with it, and that was where I wanted to go. So definitely call Dr. Trevisani. I would prefer you call him over anyone, because I know him personally, and I'm telling you, he's all that. I appreciate him, and I appreciate the work that they've done, and I just felt like my life was over until I met these people. And that may take it a little literal about dentures, but when you're slapped in the face with them, and I was dealing with what I was dealing with, this guy's a hero to me. I mean, he really is. He saved my life. He really did.
Renee, you look amazing. Your smile is gorgeous. Thank you so much for coming by.
Smile for us. What do you think? Where's the camera? Cheers.
You've heard from the patients, you've heard from the doctors, and you've seen firsthand the amazing results of Lifetime Teeth Today. If you are suffering with missing or decaying teeth, failing bridges and crowns, or if you are miserable with your dentures or partials, now there is a solution. Call the offices of Lifetime Teeth Today and start your new life. We believe everyone deserves a lifetime smile. I'm Fawn Creamer for Lifetime Teeth Today. Thank you for watching.
And it was the best thing in my life, the best thing I ever did, really.
It feels like the old me is back.
Thanks to Dr. Trevisani, life's fun again.
When I first saw my teeth, I jumped up from my seat and I hugged them.
Was it worth it?
Everything has changed since this.
I'm one of the happiest people now you're ever going to meet.
I feel like I'm 20 years old again.
It's almost like a miracle to me.
If I had a son, he would be Dr. Trevisani.
But my suggestion would be, and I can't impress it enough, visit Dr. Trevisani. Go for a consultation.
Thanks to Dr. Trevisani, I'm completed.